Hi, I'm Megan Stikowski, and with me today is Director of Quality Management at HMC HealthWorks and registered nurse Eileen Donnelly. Eileen has spent over 26 years in the healthcare and nursing field with experience in primary care, pain management, surgery, behavioral health, and nursing. With her vast experience, she is here to talk to us about the novel coronavirus. Thanks for taking the time to speak with us today, Eileen.
Thank you so much for having me today.
So it's no secret that people are scared about the new coronavirus, COVID-19. As a nurse, what recommendations do you have for people?
The first thing would be to make sure you are washing your hands. That's the one thing we can do to protect ourselves and our loved ones. Make sure we use soap and water for at least 20 seconds, especially after we've been in a public place or after blowing your nose, coughing, sneezing. If soap and water are not available, use a hand sanitizer that contains at least 60% alcohol. Also, be sure to clean and disinfect frequently touched surfaces on a daily basis in your home. Your tables, doorknobs, light switches, countertops, your desk, phone, keyboard, toilets, faucets, and sinks. If surfaces are dirty, clean them prior to disinfecting. And lastly, avoid touching your eyes, nose, and mouth with unwashed hands.
Yes, absolutely great advice. What do we know about how COVID-19 is spread?
So, the virus is thought to be spread mainly from person to person, between people who are in close contact with one another, within usually about 6 feet. It can be spread through respiratory droplets produced when an infected person coughs or sneezes. These droplets can land in the mouth or noses of people who are nearby, or possibly even be inhaled into our lungs. So, therefore, the best way to prevent the illness is to avoid being exposed to the virus. Social distancing. Stay at home as much as possible, and when you do need to go out, put some distance between yourself and other people. It's also important to remember that some people without symptoms may be able to spread the virus, so the CDC is now recommending to cover your face with a cloth face covering when you have to go out in public. Megan, we need to remember COVID-19 is a new disease, and we are all still learning about it and how it spreads and the severity of illnesses it causes.
Mm. Very true. And we know that the virus is spreading. Not everyone can practice social distancing, as many people are taking care of someone who's sick. What recommendations do you have for caregivers?
So, if possible, we want to give that sick person their own room to stay in and keep that door closed. Have only one person serving as the caretaker. Ask the sick person to wear a face mask if they're able to. If it causes any breathing difficulties, they shouldn't wear one, but the caretaker should wear a mask regardless.
And you know what, speaking about the masks, you mentioned that the CDC has a new recommendation. What are the new guidelines?
So the CDC now recommends wearing cloth face coverings in public settings where other social distancing measures are difficult to maintain, such as when we need necessities at the grocery store or the pharmacy. So the coverings will slow the spread of the virus and prevent the people who may have the virus and not know it from transmitting it to others. Cloth face coverings can be fashioned at home from common materials at a low cost. Actually, if you look on that CDC website, they have instructions for making one of your own.
That's a great idea. And you know what? It is best to stay home. In fact, even if you're feeling sick, the CDC is advising that you call first. Is that correct?
Yes, that is definitely correct. If you develop symptoms such as a dry cough, a fever, or you've been in close contact with a person known to have COVID-19, or maybe you've recently traveled from an area with the ongoing spread of COVID-19, stay home and call your healthcare provider. Many are now offering telehealth services as well, so you can avoid an office visit. Older patients and individuals who have severe underlying medical conditions should contact their healthcare provider early, even if their illness is mild. There's also this really great self-checker on the CDC website that can guide you on a step-by-step basis, offering you recommendations as to what steps should be taken next.
Okay, well, that sounds helpful. But at what point, should we bypass the online self-checker and seek immediate help?
That's a great question, Megan. So if you have any severe symptoms, such as trouble breathing, persistent pain or pressure in your chest, any confusion, a bluish tint to your lips or face, or if one of your family members, you cannot arouse them, you definitely want to make sure that you're seeking care immediately. And if a medical emergency does arise and you need to call 911, make sure you do notify the operator that you think or that you may have COVID-19, and if possible, maybe put a face mask on before the help arrives.
Well, thank you very, very much for taking the time to share all this great information with us today.
It's been my pleasure, Megan. Stay safe and stay healthy, everyone.
Thanks, everyone, for listening in, and stay tuned for more HMC HealthWorks podcasts.